Hi friends, welcome to classes by Lab Doctor. In today's class, let us study what are the causes for high cholesterol. So हमने हमारे प्रीवियस वीडियोस में देखा है कि कोलेस्ट्रॉल का नॉर्मल रेंज कितना होना चाहिए, व्हाट आर द बॉर्डर लाइन कोलेस्ट्रॉल, व्हाट इज डेंजरस लेवल ऑफ कोलेस्ट्रॉल. सो अगर कोलेस्ट्रॉल का लेवल इफ इट इज मोर देन 240 एंड हायर, दैट इज कॉल्ड एज dangerous cholesterol. Agar if the cholesterol level is between 200 to 239, it is borderline, and if it is under 200, it is acceptable or it is required for a healthy heart. Similarly, if the LDL cholesterol is more than 160, it is at a dangerous level. Anything between 100 to 159 is borderline, and less than 100 is acceptable. Similarly, if a HDL cholesterol is more than 60, it is required for a healthy heart. It is very good levels of HDL cholesterol. If the HDL cholesterol is between 50 and 59 in the females and between 40 and 59 in men, then it is borderline. And if it is less than 40 or less than 50, then it is under the dangerous level of HDL. So now there are many factors I have told you which affect the cholesterol level, because the cholesterol, as you all know, as we age, it rises. So the with gender it changes. So there are other factors also, like the genetics. Suppose if you have a family history, or there is a hypercholesterolemia in the family, there is a heart disease in the family running, so then all these can change the cholesterol levels of the individual. So genetics also can change the cholesterol level. Weight, like when you see that a person, if he's overweight or if he's obese, then we see this increased cholesterol. Not that all the obese people will have increased cholesterol. If the person lacks any kind of an exercise, physical activity, he's not at all moving, he is very sedentary, then also we expect his weight to be high and his cholesterol levels also to be high. If the person is having too many unsaturated fats, is having processed food, ultra processed food, etc., and there are no fibers, then also he can have an increased cholesterol. If the person is smoking can increase the LDL cholesterol and can reduce the good cholesterol. And like blood pressure, heart disease, diabetes, all share similar risks. So all of this can also increase the cholesterol levels. So I have told you that being overweight sometimes can increase the cholesterol level. Not that whoever are overweight will have an increased cholesterol, but when you are overweight, what happens? The body will produce more cholesterol, and there is a difficulty in removing the bad cholesterol, LDL cholesterol, also from your bloodstream. That is why the level of LDL cholesterol starts rising in your blood, and you are at risk of heart disease, diabetes, hypertension, etc. So obesity is linked to higher level of bad cholesterol and lower level of good cholesterol. So being overweight can be one of the causes which can increase the cholesterol. Lack of exercise, a person who is having a sedentary lifestyle, who doesn't move much, there is no exercise. So what happens when the body is inactive? The body is less efficient in removing the bad cholesterol from the bloodstream. So when the bad cholesterol starts building up in the bloodstream, it will try and block the arteries. Simultaneously, it will lower the production of the good cholesterol also, and good cholesterol is required to clear the bad cholesterol. So when a person is not very active, this LDL rises, the cholesterol rises, and this will increase the risk of heart disease, stroke, and other cardiovascular complication. So exercise is very important because it helps in the proper muscle functioning. It helps the body to utilize cholesterol more effectively by transporting it to the liver for breakdown and for promoting better cholesterol management. So being very sedentary or not having an active lifestyle can also be a major risk factor when we think of high cholesterol. Next is diabetes. Diabetes will try to reduce the good cholesterol, and it will try to raise the triglyceride and also the LDL. So whenever there is a combination of diabetes, high BP, increased cholesterol, all these things will go hand in hand, because the risk factors for all this will be almost similar. A sedentary lifestyle, an unhealthy diet, all this can contribute to diabetes, heart diseases, etc. So when in diabetes such lipid profile is deranged, when you see you get high cholesterol, high triglyceride, you get low good cholesterol HDL, that is called as diabetic dyslipidemia. The fourth condition which might cause high cholesterol would be your chronic kidney disease. So what happens in the chronic kidney disease is there is altered metabolism of the lipoproteins, and also the altered metabolism of triglyceride rich lipoprotein. So there is changes in the route of reverse cholesterol transport, etc. So when all these things happen, there is insulin resistance, there is proteinuria, there is increased lipoprotein. All this will contribute to chronic the increase in the cholesterol, and that in turn can block the renal arteries and can worsen your kidney disease also. So they will have effect both in the both ways. So chronic kidney disease itself can cause increased cholesterol, and increased cholesterol can again worsen the chronic kidney disease. PCOS, that is polycystic ovarian syndrome. So this polycystic ovarian syndrome is very common nowadays. We see it very commonly in these young girls, and women have symptoms like hair loss, they have sleep problem, they are obese, they have hirsutism, unusual hair growth on the cheeks, on the chest, etc. There is problem conceiving, infertility is there, they have insulin resistance, they are overweight, their periods are irregular, they have acne, they have mood disorders, etc. So in the PCOS, what happens? There is insulin resistance, there is abnormal hormone level, which can cause this cholesterol also to be on the higher side. Next, I have told you genetics. There are several disorders which can cause increased cholesterol levels, like they have familial combined hyperlipidemia, you have familial dysbeta lipoproteinemia, familial hypercholesterolemia, familial hypertriglyceridemia. All this can cause increased cholesterol or deranged lipid metabolism. So this familial hypercholesterolemia, what you say, this is a genetic disorder that will cause increased level of this bad cholesterol in the blood. So it passes down from one or both the parents. This can come to the children. So the patients will have high level of bad cholesterol. They have this Achilles tendon, which is very painful because of the development of these xanthomas. They develop xanthomas on the knuckles, elbows, and knees. That is deposition of this cholesterol crystals. They have this yellowish areas around the eyes. There can be chest pain. There can be a pain while walking, claudication, etc. So these things we can see in familial hypercholesterolemia. So patient can have complications also, like patient can have heart attack, stroke, sudden death, etc. So I have told you that genetics also plays a role here, and this in the hypercholesterolemia there is mutation of lot many enzymes, what you can see, like the LDLR gene, APOB gene, etc. All this can cause hypercholesterolemia. So whenever there is the genes which are involved in the metabolism of cholesterol, whenever they are targeted, this leads to the familial hypercholesterolemia. So you can see that genetic pathogenesis, what are the genes involved? The most common gene involved would be this LDLR mutation and the PCSK9 gene mutation, which is seen in around 6% of the cases. So all this can cause this familial hypercholesterolemia. It can be autosomal dominant or it can be autosomal recessive. So these are the signs you can see here. You can see the tendon, the xanthomas. Here you can see xanthelasma around the eyelids and corneal arcus you can see here. So all this suggests a familial hypercholesterolemia. There are few medicines which can increase the cholesterol level in the blood, like high blood pressure medicines like beta blockers. They can increase the cholesterol level. If you are taking diuretics, they can increase the bad cholesterol level. Certain antipsychotics can increase the bad cholesterol. Some antidepressants can increase the cholesterol. Certain chemotherapy medicines, certain immunosuppressive medicines, retinoids, steroids, antivirals, like especially when we used to treat this HIV, hepatitis C, etc. Birth control pills, they can increase the cholesterol level. And certain fish oil supplements also, they contain saturated fats and they can also increase the bad cholesterol. HIV, I have told you that HIV disease and viral replication can affect the cholesterol levels, and HIV medication, some of the HIV medication, they can also increase the cholesterol levels. And other factors would be smoking, etc. They also increase the cholesterol levels, because smoking, I have told you, it will reduce the good cholesterol and it will increase the bad cholesterol. Hypothyroidism. I have told you thyroid is a very important hormone. It plays a very crucial role in maintaining the cholesterol metabolism. So when you have less thyroid, the clearing of the cholesterol from the system is impaired, and the removal, because it is hampered, the cholesterol level can rise. So these are the various causes of high cholesterol. So it could be genetic, like you have familial hypercholesterolemia, or it could be because of an unhealthy diet. You are consuming a lot of processed food, ultra processed food, lots of fatty food, sugary food, less of fiber in your diet. All this can cause increased cholesterol levels. Being sedentary, lack of exercise, no active movement can also impair the muscles to intake the muscle uptake of cholesterol, and they can lead to increase cholesterol levels in the blood. Smoking, I have told you, that will reduce the HDL and will increase the bad cholesterol. Excessive weight can increase the level of cholesterol. Certain medications like antipsychotic, antidepressants, beta blockers, anti-retroviral medicines, they can increase the level of cholesterol. Underactive thyroid, that can increase the level of cholesterol. Polycystic ovarian disease, your diabetes, your hypothyroidism, lupus, all this can lead to increased cholesterol levels, and that can lead to complications. So these are all the causes for high cholesterol. So in the next class, we will deal with symptoms of high cholesterol. That was all about the causes of increased cholesterol level in the blood. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.